Hello friends, I'm Dr. Vicky Jain, plastic and cosmetic surgeon practice in Mumbai. Today I'll be talking about the frequently asked questions in gynecomastia. First question, what is gynecomastia? Gynecomastia is enlarged male breast. It can be due to fat, it can be due to gland or both together. It can be called as chest fat, pseudogynecomastia or gynecomastia. The problem, it is bothering you mentally. It doesn't give any physical pain. Why does gynecomastia occur? The most common cause is hormonal imbalances during your teenage days. This can happen. And the most other cause is idiopathic. Idiopathic, the cause is not known. 20% of the males have it. There is no such call as disease, it's called a condition. Just like obesity is a condition but not a disease. Does gynecomastia go away on its own? It can go away on its own, but if it persists at the age of 18, it is going to stay. It will require only surgical intervention or you stop bothering about it. There's no other way gynecomastia goes away on its own. Very rarely I have seen gynecomastia going away on its own. What is a gynecomastia surgery? Gynecomastia surgery is surgery which will get you rid of gynecomastia. So a lot of surgeons do it and plastic surgeons also do it. Plastic surgeons make sure that they take care of the aesthetics of the breast, of male breast. Even male breast has aesthetics. What we do is liposuction, that is chest fat removal with a small cut, and we do gland removal to give an appropriate contour and a shape and aesthetic to your male breast. Who is a good candidate to operate for gynecomastia? A person who's overthinking about it, it's bothering, the confidence is going low, it is hitting him mentally rather than more than physically. He is not able to wear a t-shirt, to remove a t-shirt. That's where he is the best candidate and he's suffering since years and he's above the age of 18. He's the best candidate to get a surgery done. How is gynecomastia surgery performed? As I told you, liposuction is being done and gland removal. Both are taken care of. The chest fat and the gynecomastia, the gland, both are taken care of in the surgery. It's a 1 hour painless surgery. Is the surgery painful? The surgery is not painful. It is done under general anesthesia for your safety to make sure the pain is not there and everything is under control. The risk involved in gynecomastia surgery. The risk involved are, yes, any surgery we do, there are risk involved. There are complications. First complication is bleeding. Anywhere we cut in the body, bleeding can happen. Infection, similar with bleeding, anywhere we cut in the body, anywhere we get a cut in the body, infection can happen. There are something called a seroma and hematoma which can happen because of the bleeding. And one important thing is scarring and unsatisfactory results. I tell them satisfaction is somewhere in your mind. If you are satisfied, you will stay satisfied. If you are overthinking about it, you will never get satisfied. What about after surgery care? After surgery, you are given a pressure garment which you have to wear 24/7 for at least 4 to 6 weeks to make sure that hematoma and seroma doesn't come back. You have to avoid riding a bike or driving a car yourself for at least next to 10 to 12 days. Avoid smoking at least 5 days before surgery and you have to make sure that you are wearing pressure garment. Regular follow-up with the doctor is very important. And go back to your normal work in a couple of days and to gym after 1 month of the surgery. The common question is, when will I be able to see the results of the surgery? The results are seen immediately on the first day or the second day when you come after surgery for pressure garment removal and the first check dress. You will be able to appreciate the results immediately after surgery. A lot of people bother me about the scars after surgery. The scars are very bare minimum. They are hardly seen. Anyone who wants to see the scars will be able to see. As I tell you, beauties and the scar lie in the eye of the beholder. Who wants to watch a scar will watch a scar in you. I don't think so the scar are a problem. I have seen hardly any patients of mine coming back for the scar and its treatment, because I make sure I give the scar treatment immediately when the wound is healing. Will gynecomastia come back after surgery? I have never seen any patient who I have operated see a recurrence in them. No patient has come back with a recurrence. A couple of patients have come with unsatisfactory results. They must have not followed the instruction. As I tell, pressure garment is very important. If you don't wear a pressure garment, your skin doesn't contract really well. Does insurance cover gynecomastia? Sometimes the insurance might cover the gynecomastia if it is unilateral, and sometimes when it is painful. We can try our luck, but maximum time gynecomastia is not covered under insurance. What happens to my muscle after gynecomastia surgery? I tell all my patients that gynecomastia surgery is something superficial to your muscle. We do not touch your muscle, we do not injure your muscle. The strengthening and exercise won't affect anything after surgery because we are doing nothing to your muscle. Your muscles won't shrink, nothing is going to happen to your muscle after surgery. How long the results last after gynecomastia surgery? They last lifelong unless and until you take any hormonal pills, you take anabolic steroids, or you make sure that you're putting a lot of weight, maybe 15 to 20 kgs. That's where a bit of chest fat can get accumulated over your chest. I have never seen any recurrence and the results last lifelong. A common question is, will it affect my ability to have children? It is a superficial surgery. It has nothing to do with the hormones, nothing to do with your ability to procreate a children, nothing to do with sexual life. You become more confident after the surgery, the sexual life is much better. I have diabetes and blood pressure. Can I go through this surgery of gynecomastia? Yes, surely you can go ahead with this surgery, but both have to be under control. Any comorbidity has to be under control and has to be taken in writing. Surgical safety. If you have any comorbidities, you have to take a letter written for a surgical safety from your treating doctor that this comorbidity, BP or diabetes doesn't bother you during your surgery. This surgery is a safe surgery done regularly by me. Are there any non-surgical treatments for gynecomastia? I say you can diet, exercise, you can make sure that you have a healthy life, and do not try any medicines because they don't help you. Do not try any injections or any non-surgical treatments such as Ulipo or Zerona. They won't help you to make sure to get you rid of your gynecomastia. Surgery is the only option if it doesn't go away with diet exercise. Does diet and exercise help you to get away with gynecomastia? Yes, it can help you to get away with gynecomastia. You can try for at least 3 to 6 months, but if it doesn't help you, surgery is the only option. What is an ideal age for a gynecomastia surgery? The ideal age is above 18. A person is an adult, he can take a consent, he can sign a consent and he can make his own choices. If it is bothering you mentally, studies are getting affected, social life is getting affected, your confidence is getting affected, then yes, we can operate you before the age of 18 also. How do I know that I need this surgery? This is a purely cosmetic surgery. You yourself have to decide that do you need it. If you need it and if you think about it, yes, you need it. If you're not thinking about it, just go home, enjoy, relax. There is no need to get this surgery done. It's a avoidable non-emergency surgery. What happens if I have a seroma and a hematoma? There's nothing to worry. Seroma and a hematoma, seroma is liquid-like collection. Hematoma is something blood collected. But there's nothing to worry. They can be removed with a syringe and a needle in the clinic itself. It won't affect anything. There is no risk to life after surgery. This is a safe surgery. And I conclude that gynecomastia surgery is a safe surgery. If any questions are there, you can send me on my message or comment box. For further gynecomastia surgery and plastic surgery surgeries, please do like, subscribe and share. I will be helping you to get the best possible knowledge. Thank you.